Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jahangir Wellness Center. My name is Kabas Jahangir, and today I'm joined by the lovely Miss Zenobia Pajnikar. Thank you so much for being here, Zenobia. Today we're going to be talking about something that we do very uniquely here at the Jahangir Wellness Center, and that is Bowen therapy.
Yes.
Right? Why don't we just start with that? What is Bowen therapy? Because it's something that I honestly only heard of when we just started here.
Okay. Thank you for having me here.
Sure.
Bowen therapy is a very simple, harmless therapy. We work on the muscles, light moves on the muscles of the body, and the body heals on its own without harming the body.
But it's like a touching.
Just
it's like a,
rolls. We roll the muscles.
Okay.
That's all we do. No hammering, no hitting, no medicines.
Right.
And we have helped people who needed surgery in 3 sittings, half an hour sitting once a week. I and my colleagues have put them right
Okay.
permanently. But they go back to zero if their posture is wrong and the vitamin D or B12 is less.
Okay.
These are the 2 important things we have to tell our clients
Right.
maintain.
But coming back to where it came, where did they start? How long
They
has it been around
started
for?
in Australia, in Geelong. Tom Bowen was the one who started. He wasn't a doctor,
Okay.
but with intuition, he started in 1950.
Oh, okay.
Yes. And then Tom, Ozzy and Elaine learned from him. And then now they are doing it in many countries. They are 80 and 88 years old.
So it's like a certified.
Yes,
Therapy.
it's a certified therapy from Australia.
Oh, it's okay. It's from Australia.
Yeah, and I learnt it because my husband was down with a back problem.
Okay.
And my teacher, who's my sister-in-law, visited us.
Okay. Right.
And he was given painkillers and bed rest. So when she did the Bowen on him, first of all, he said, what you're doing,
Exactly. A lot of people will have that
Yeah,
perception.
they have
that
it.
what
But
you're
once
doing-
they do it, they bless me. Okay. So when she put him right in one sitting,
in one sitting,
he was normal.
how long did that sitting take?
Half an hour.
Okay. Of just maneuvering the muscle.
Yes.
Okay.
And after that, I was always wanting to be a doctor.
Right.
But the sight of blood, I can faint.
Me too.
Yeah.
Still.
So I worked as a secretary for 35 years.
Okay.
Then when she did this and she came as a teacher,
Right.
we gave talks everywhere, but there were 3 in Bombay and I was the only one from Pune who wanted to really learn it. I said, this is my heart.
Right. Yeah, because it's so.
Yes,
I mean,
it's so beautiful.
fantastic.
We don't harm the client 101%.
The least invasive kind of therapy. You're not poking people. you're not
Nothing.
drawing
People
blood,
sleep
you're not-
off when the treatment is going on in
I
the half
see.
an hour. Yes. And I have done people with slip disc, sciatica operations. People have come from hospital to me. Not me, even my colleagues are doing it. Now,
Right.
8 of them who are my clients.
Okay.
One is a teacher in Pune now. She has been taught by my teacher.
Right.
2 in Delhi and 1 in Bombay. But they are certified by my teacher when she comes finally.
Okay.
And they get certificate from Australia.
I see. But it's not just muscles. I mean, you can do more. You can treat.
It
far
works
more things,
everywhere.
right?
I've helped a girl who didn't get period for 33 years.
Okay.
She's getting normal period. We help in conceiving.
Really.
We help in panic attacks,
Okay.
migraines,
Right.
acidity, vertigo. Vertigo goes in one sitting. I've done it for many. Now, vertigo is mainly acidity in the person's body. And
Okay.
if we take Vertin, it adds to it. So I don't advise any medicine. The treatment, 3 treatments is enough. But if a person is negative, nothing happens.
As in, you mean negative mindset.
Huh?
Do you mean negative mindset?
Yes, if they have a negative mindset, I said, and I tell them, you don't feel good, don't come.
I can imagine a lot of people must be skeptic about this kind
Yeah,
of
but
thing.
after they treated, like one incident I'll tell you. I got a client from Kopargaon. His wife needed back operation.
Okay.
He and his wife tried the therapy. And after a few years, she came back because she had chikungunya.
Yeah, which I've had and it's terrible.
Yes, that takes time, but Bowen helps to recover faster. So he came to me and said, Madam, let me tell you the truth. When I took the treatment with my wife, I said, this treatment is bogus.
Yeah, because honestly, I've done this with you and I honestly had that first impression as well. This sounds kind of.
Yeah, but now after you put my wife right, who needed operation in 3 sittings, I'm singing your song in Kopargaon.
Lovely. Yeah.
Even cancer patients,
Okay.
we don't cure them,
Right.
but our treatment
Helps.
pulls them up after
Right.
chemo.
Which is actually comes to a question I was going to ask what you talked about, in terms of medicine and so forth. Now, is this something that one can take along with medicine as a
See, I say-
supplement?
no.
As in it helps along with
Medicines, antibiotics, and painkillers cause you acidity.
Okay.
So without the painkillers, if they manage it, I'm sure they get well. But some people, like doctors say, take for 1 week. We don't stop their medicines.
No, that's the question I was asking.
Yeah,
So
BP
when someone
medicines
comes
we
to you,
don't stop.
you should continue medicine
Continue
and do this along
medicine,
with
but if you have painkillers, I say avoid it. If you don't need it, don't take it.
Yeah, of course. But if it's something that, they've got some treatment that's going on,
No, then
this
we
is
don't
something
stop. No
that
stopping.
goes along
No
with it
stopping
and only
because
helps
doctors
them.
know best.
Of
We are
course.
just therapists.
Yeah. But this is something that can only help, as you said. There's no harm.
Yes. 101%.
Yeah.
If some doctors cannot do things, our treatment has helped. Like in Australia, my sister-in-law helped my daughter-in-law.
Right.
One child's bone was not growing. He was 7 years old. He was in crutches.
Okay.
Can you believe after Bowen, his thing was growing? I mean,
So what are the most common things that
everything.
come to you?
Everything. I have had a person whose heart beating only 30%.
Okay.
He was very regular, very sincere. One day he tells me, Zenobia, auntie, I want to talk to you. I got scared what's happened to him. He said, I checked the count and it's 60%. I cried with happiness
Wow.
because I didn't know I could help somebody to that extent. No, we come to know how the patients get the other main problems we know, but these are something different.
Right.
Like the bone growing for the child, even conceiving problem.
Okay.
People do get conceived with Bowen.
Right. So how is this different to something like acupressure, which is sort of similar where, people are-
Acupressure is a little more pressure. Ours is very light. It's
Okay.
like eyeball move. People say after the treatment, madam, what did you do? I said, how did you feel? I said, you felt good. That's important.
Right.
What I did is not important. What you feel is important.
Can you tell us any impactful stories that you've seen where this is played out in front of you as a therapist? Some strong, where you've seen this immediately impact someone
Lot
you're
of
dealing
people,
with?
yes. Like I have one girl, Smita, whose husband is in the army. He's
Okay.
retired.
Right.
He had a knee injury because he climbed the ice places when they mountains and where
Right,
they
right.
climb, na?
The passes.
Yeah, when he had a jhatka on his knee.
Okay.
That jhatka was not going for years. He came to me, took my sitting, and in one sitting he was fine.
Wow.
That's how he made she took as a teacher, she used to come regularly to me and he used to enjoy it. So he found that this is something. So it doesn't happen to everybody. But yes, one or two happen and they are really happy.
Really?
I get clients coming back to me to take my blessings
Okay.
because they felt so good with what I did. It's not me what I did, it's the treatment.
Right.
So I think it's something really wonderful and people should benefit. by
But how many times should people be coming back for this kind of thing? Because you said in some
I said
cases you've
minimum
done
three.
it.
Minimum 3 sittings I've put people right who needed operation.
Right.
One peon came to me whose boss used to come.
Okay.
He was fixed for a sciatic operation.
Okay. And you're saying then after 3 sessions he didn't
He
need
was fine. He joined his finger and said, Madam, आपने मेरा पेन निकाल दिया और मेरा 2 लाख बचाया.
it? Wow.
This is one incident. There are so many.
Fascinating. But it's a shame that it's not known as much.
It's not known. People take time to understand.
Yeah,
But
and-
once
and
they take it,
trust it.
Yes. Once they take it, they are thrilled.
So the best way to convince someone is just to try it.
Try it, yes.
Yeah.
Yes.
And where are places that we can try that here?
Places like, this is the place, one of them.
The wellness center.
And
the
Wellness Center, I appreciate it. This is the only hospital that is accepting natural therapies.
Right.
And we don't have clients who can immediately take it because they're from all over Pune coming here. But they are quite happy to know about such a therapy.
Right.
Now, we have ours in Bombay, in Delhi,
Okay.
in Madras and Bangalore. One in Bangalore, Madras, but the Bombay and Delhi have lots. And the teachers are there too in Delhi, one in Bombay and one in Pune.
Right.
So they teach, but the final teacher, my sister-in-law, very strict teacher, she has to certify them, then they get their certificate.
Very strict teacher.
Very
How,
strict.
how long does it take to get your certification?
1.5 years it took me.
Oh, really? 1.5 years?
Because you
Wow, that's a
learn
lot.
a few modules, you practice,
Okay.
you have case studies, and when you're practicing also, you get results. At least I got wonderful results.
Okay. So, like, for example, that's a good question. How do you ascertain if someone just to come to you and say that, I've got pains here, there, but they can't exactly tell what's wrong with it?
Yeah, I just give them the basics, what I have to give.
So, exactly. So, the question I was going to ask you is that if you just ask someone to lie on the table, what is it that you're feeling for to be able to ascertain what's
Nothing,
wrong
I
with
don't
them?
feel anything. I just start with the BRMs.
VRM is?
BRM is lower back moves, upper
Okay.
back moves,
Huh.
neck and shoulder, the basics. Now, if he comes with a back problem, I do pelvic and hamstring.
So, there's actually stretching and exercises involved as well.
No, exercises we give 1 or 2.
Okay.
And I give a few yoga exercises to help them to maintain their body
Okay, fine.
on my own.
Right. As
So
a-
it's,
okay,
as I exercise to keep the body maintained.
which is extremely important.
Very important.
Yeah.
Very important. And how they should sit is very important.
Right.
Because after sciatica, one should not sit too long. And after slip disc, one should not slouch.
Yeah.
You go back to zero. So Bowen has put you right, but you go back to zero if you sit wrong.
So a lot of lifestyle problems that people are facing can be fixed with
Yes, yes.
Bowen today.
And I'm very strict with my clients.
What is that?
They know
Take
it.
them back.
I tell them, if you come back, I know you've done wrong. So they bluff me, but I know they've sat wrongly.
Sorry, say that again?
If they have come with a back problem, similar problem,
Okay.
I know they have sat wrong.
Okay.
So I
So
said,
what do you
"Don't-
tell them?
No, they know. Even if they are late, I'm very strict. The rickshawalas know that this madam is strict.
That's good. That's good. As long as you're on time, then that's
I'm
fine.
always on time, 15 minutes ahead.
Well, that's good. That's lovely to have people like you being able to spread this kind of therapy,
Yes,
which, as you said, the important thing is that it can only help.
Yes.
It can't harm.
Not harm at all. That's why I've learned it.
Absolutely.
Because I know I'm harming nobody.
And the impact of it.
pleasure I get is tremendous.
Okay.
Tremendous.
And it's probably that kind of energy that comes from you that
Yes.
that actually translate
Yes.
pretty actually being helpful
Yes.
to patients. So thank you so much for offering this
Thank
kind
you.
of thing.
And thank you for having Bowen in your hospital.
Absolutely. Any last words, Zenobia, that you'd like to share with us? Just
I'm
stay.
very grateful to you. And I love this place.
Thank you.
Even if we get no clients, we have that pleasure of talking about Bowen
Well, absolutely.
and spreading it.
Well, it's like what we said. It's what we're trying to do over here is to actually
And people do appreciate. Some people are okay, don't want to hear fine.
right, yeah.
But many people appreciate it.
Yeah, we're trying to offer true wellness in all its forms.
But it's very, very lovely.
Good.
And yes.
Thank you so much for everything you do, Zenobia.
Thanks so much.
Thank you. Thank you for joining for this week's episode. Look forward to seeing you next week. But before you leave, please don't forget to hit the like, subscribe, and share button at the bottom over here, probably. So thank you and see you next week.